So glad to talk to you today. So, what we are doing is we are doing a spotlight series on the top functional medicine practitioners in our area, in the Pooler, Savannah area. And of course, you are my number one. And so, I wanted you to be able to just tell our community a little bit more about you, about what you do, about what you specialize in, what you're passionate about, and how our community will be able to find you and work with you.
Oh, wow. Um, well, thanks for having me. Um, I'm honored. Um, let's see. Well, I guess first I need to start with functional medicine. So functional medicine is getting to the root cause of the problem and not just masking it with more pills. And here's the deal. The pills can also be supplements. So it's not just masking it with supplements too, because I have a lot of patients, they don't want to fix their diet and I cannot out supplement a crappy diet. So
Yeah.
number one, lifestyle changes are huge. And there's a lot of people who come in who have the lifestyle completely down. So they've got their diet honed in, they got their exercise honed in, but they're just still not feeling their best. So, we do a full workup. So it's myself and two other functionally minded nurse practitioners. I went back and got my Institute of Functional Medicine certification. So back in 2020, it's growing quite popular. Back in 2020, I was one of 1,300 in the world. Now it's around 3,100 IFM certified practitioners in, well, actually the whole world. So it's internationally.
Wow.
So, as far as what we do, we look more for the root causes. So that could be autoimmune diseases. It could be hormone issues. It could be, diet changes. It could be, there is the list that goes on and on and on. Some people just come in and say, I just want to age gracefully.
Which is
um,
a good goal.
and have anti-aging. That's very few because a lot of my people are chronically ill. And so they may not acutely get sick, but they're chronically sick. And they're very, very sick people. And they've unfortunately, a lot of them can be gaslit by the medical community, meaning that, their labs all look normal. You look fine. Um, and so they may absolutely look normal, but they sure don't feel normal. And so a lot of it to be for me, so our clinic is called Faith, Hope, and Wellness. You have to have faith, then you can have hope again, because a lot of people come in like, I actually felt like I was heard and I have hope, which I haven't had in years. And then patients can be well. So a lot of it's listening and empowering the patient. Like, yes, there's something is wrong with you. You are validated. We're going to fix this. And so the people who do, that's the other thing is functional medicine is work. It's
Yeah.
not just, I want a quick fix and that's going to be it. So it's a lot of education to teach the patient as well. And it's a lot, it's a lot of investigator work. So you
Yeah.
have to find a root cause. So autoimmune can be 6 or 7 different things
Wow.
that's making the immune system angry. So a lot of the times you're ruling out one and then nope. And a lot of times it is multifactorial. So it may be we're fixing the gut. Okay, the gut was 20, 30% of it. Then, all right, now detox, it's toxic load because we're exposed to so many toxins
I
in
was
the
going to ask you
environment.
about that, about environmental factors. What do you see are the top environmental toxins or things that are affecting our health today?
Glyphosate being one. So Roundup, of course, that one's been in the news a lot with lymphoma. They have actually tied, that's the only one that I know of recently that they've tied it to. BPA plastic is huge.
Oh,
Um, so that's in our own female leggings that we wear.
really?
Is BPA plastic, yes. Um, they've gone away from mercury fillings and now they're using composite fillings, and composite fillings have BPA plastic in them. So there's a lot in women's health products. women's health products, the average woman puts on over 100 chemicals on their body before they leave the house every morning. Um,
Wow.
Whether it be, shampoo, conditioner, face cream, makeup, anything and everything, washing the dishes. So they have a lot of different chemicals that we're exposed to. And just our microbiome is a very hot topic in the functional world, and the microbiome is suffering because we're exposed to so many toxins. So like Roundup actually messes with the sugarmate pathway. The sugarmate pathway is basically bacterial pathways. And so it's not necessarily killing us, but it's killing our bacteria. And actually, if you look at a flea or an earthworm, they have around 30 genes of DNA. We only have 24. So technically, DNA wise, earthworm or flea is more complex than we are. What makes us complex is our microbiome. And so, with our microbiome being complex, it makes us complex. But if we're losing our diversity, you
Yeah.
can see where autism and different chronic illnesses are now playing a part in our chronic all of our chronic issues today is just based off of inflammation.
Oh, absolutely. How do you feel about when we start talking about microbiome, like antibiotics? I know there's a lot of controversy surrounding overuse of antibiotics.
So there is overuse of antibiotics. Then again, there's times where I have to use antibiotics. I don't like to jump to antibiotics, but if somebody has Lyme and they're having a whole lot of issues, I love to use herbs. But if things are dire, then we have to go to antibiotics. It's not something I like to jump to, but sometimes it's necessary. So a lot of times you have the risk outweigh, the benefits outweigh the risk.
Absolutely.
So you'll have I love herbs. Don't get me wrong. Herbs are one of my passions, especially for Lyme and a bunch of other issues. Let's see, what else was I going to say? But antibiotics in general, yes, they are used too much, especially I think now it's getting where a lot of mothers are less using antibiotics in their children compared to what they were in
Mhm.
our day. Our day, we didn't, I think it was kind of the start of the antibiotic revolution with all the C-chlor and the bubble gum and the liquid and all that stuff. But the 2000s, oh wow, like the mothers just took them straight in, um and would give them antibiotics. It's like, oh, they got a sniffle, oh, we're taking them in. Whereas now it's like, let their fever ride, let it try to do its job. And um but yes, antibiotics, a lot of my early 20-year-olds, I don't know if the parents just didn't let them play outside. Some of them were C-section babies. Some of
Mhm.
them were given multiple antibiotics from 0 to 3 years old. So we go into all that in our health tech history from like birth until now. And so one of my oldest patients, C-section patients, is 62, but I have one that's 49. And she had diarrhea, chronic diarrhea. She couldn't drive from here to Atlanta without having, she just couldn't eat. If she didn't eat, she didn't have an accident. And, which was horrible because she really wanted to travel in life and everything else. So we did a stool test on her. Again, she was a C-section baby. So I guess I need to explain C-section. You're making an incision in the abdomen, pulling the baby out from there. So the baby isn't coming through the vaginal canal, picking up the microbiome of the mother. So basically, what happens is there is a doctor, OBGYN up in Harvard, who is testing babies who are born by C-section, testing the microbiome of the baby, testing the microbiome of the mother, and they don't match. So
Wow.
she's doing a seed procedure, so she calls it, where somebody's a C-section baby, she sterile cloth wipes the vaginal microbiome and then rubs it on the baby's face. And then she's retesting the microbiome of the baby and the mother, and they match. So just that little bit of microbiome inoculation of the baby, it helps the baby. They've come to determine kids have less asthma, less allergies if they are not C-section babies.
Wow. Wow. That's something
So,
I talk to a lot of moms about too, as far as when they're making birth choices and decisions as far as vaginal versus C-section. And that is one of the benefits of a vaginal delivery, is
yes,
like
it
being able to get that seating and be able to get the those good healthy bacteria.
right. There's more research now going on that baby actually may be exposed in utero to mom's microbiome, delivered through the bloodstream, which is completely fresh off the docket, at a conference I just went to in November. But this one lady in particular, she had hardly any microbiome. She was eating all the right things to feed her microbiome, but she wasn't making any butyrate. And butyrate is a postbiotic, and butyrate helps keep you from getting diarrhea. So she was not making any butyrate, hence why she was having diarrhea. So we gave her some butyrate, and her whole microbiome was on the very, very low side. So what I did is I told her to go play in the dirt. I told her to do a garden. I told her to go play in the ocean and start hiking and really, really getting into those good microbes, anywhere in the earth. Well, she took me literally. She went to Antarctica. She went to Spain. She went to Costa Rica. She went to South America, and South Africa. And she, in a year, built up her microbiome back. Mostly probably because she was eating all these other foods in these other countries, which have loads of microbiome on them. Why? There's no pesticides really there. So
Wow.
she's absorbing her B12 again, whereas before she was not. Like, so her microbiome is so much healthier. She looks healthier. She doesn't have the diarrhea as bad anymore, unless she eats something, bad that she's not supposed to eat. But yeah,
I love those tips because I think one of the big things now is like probiotics. Everybody's talking about like ingesting good bacteria, but like you
right.
said, just playing in the dirt, going in the ocean, being out in nature, which is something for a lot of us that we don't necessarily do, but that is how we can increase our exposure, like you said, just
Exactly.
to
The
the good.
thing is, there are so many millions of microbes that we haven't even discovered. There's only about 100-ish that are in a petri dish in a bottle. And so here we are taking these microbes every day, and what we're doing is creating a monoculture,
Mm,
meaning we're creating the big, big populations of the same bacteria. And other thing, that's if they're even getting down there, because they have to be viable through the stomach acid and then make it through the small intestine and then open up in the large intestine. So
mm,
as you see, it takes them a while to get where they need to go. So
right.
that's if they survive even getting down there. So some of the probiotics you may be taking, they just may be washing. So that's why it's important to have a really, really good probiotic, something that may be bile resistant, meaning that the bile isn't going to break it down through the stomach acid, and it's going to pass through and actually get to the large intestine where it needs to be. That's why it's important to look. And it's
Yeah.
also important to switch your probiotics. So
Hmm.
I have patients switch up their probiotics. Don't be using the same probiotic over and over again, because you're going to get a monoculture.
I know I had took a class from a nutritionist and she said about every 2 to 3 months. I don't know if you kind of
Roughly, sometimes I'll do a monthly, sometimes 2 to 3 months. It just kind of depends on the patient.
cycle
And it
through.
also depends on how low they are and the strain that you have them in, because a lot of times, we can do PCR testing on specific strains of probiotics. And so those specific strains really, you want to put them on a little bit longer if they have none in their gut.
Yeah. I love that you talk about that because I think so much of it right now for a lot of people it's just guesswork. They say, okay, I'm having gut issues. I'm going to take a probiotic. They find a random probiotic on Amazon and start taking it. But like you said, it's about figuring out where you are low, and it's more of a personalized approach versus just take this one brand or this one strain.
So So this is not bashing other functional providers, but you will find a lot of, and I get it too because it's getting functional medicine out there. So you have a lot of well-known providers, they have protocols and things of that nature. But here's the deal. You and somebody else down the road, y'all are not alike. It's not treating robots. And so you may have a specialized, everything I can tell you at Faith Open Wellness is specialized because of the fact I don't like to guess. Um, sometimes it is practice. We do have to make an educated guess, and sometimes you're right, and sometimes you're wrong. It's the whole point of practice. But I love doing GI tests like Genova, because Genova specifically, they will use Petri dish. They're the only ones that I know. It will use Petri dish and it will use PCR. So PCR is more of DNA sequencing. So they look at how much DNA of, let's say, E. coli is there, but then they will grow E. coli on the Petri dish and it may not be robust. Then again, it may be robust and you really want E. coli in your gut. And so I have some patients, they have no E. coli in their gut. There's really not a good situation at this point to go and put E. coli in the gut because it's probably going to make you sick, with food poisoning. But people really need E. coli in their gut for a healthy gut. And it's not one of those things that it's replaceable at this point,
Right.
which would be nice. But there are a lot of patients you find they do not have good E. coli in their whole milieu of their microbiome. So
What should those patients do, or is it just kind of something that you have
So
to see?
sometimes so you've got a product called like Megaspore, they'll claim that, their spore-based probiotic, well, they have the research to prove it. I don't know necessarily about E. coli, but they have other ones that they will build up diversity of other microbiome bugs due to those bacillus spore-based species of probiotics. So they have their research to back their products. But again, it's go dig in the dirt, breathe the air in and
Yes.
put your feet in the dirt and try to, I'm not saying eat with dirty hands, but definitely your vegetables, our soil, that's another thing. Our soil isn't as fresh with nutrients as it used to be either. So that's a lot of the thing is we're not getting the nutrition in the nutrients either of our food because we're growing it even like outside my in my yard. I have my winter garden, so I have radishes and lettuce and kale and things like that. It's going to be nutritious because it's organic, but it's
Mhm.
probably not going to be as nutritious as our grandparents would have eaten off of the land, because when you use up the land, we're not putting the nutrients back into um, the soil like we used to.
You're very correct about that. I
So we
did
just kind of keep
ask.
stripping it.
Yes. So for patients who currently have, say, a regular like primary care doctor, and they're wondering, do I need to also see a functional medicine doctor? Um, what would you say to them as far as why it would be important to maybe do to have both?
So I have a lot of patients who I actually request that you still keep your primary care provider. That way, in case, like, let's say you get sick, half the time they are messaging me because they want some natural fix. They don't want to use antibiotics. They don't want to, they try to avoid those things. But a lot of times I'll tell them to keep their primary care. Number one, I don't want to be on call 24/7, like other physicians are and providers and nurse practitioners. But yeah, I tell them to keep their primary care, but a lot of times we will see both. So a lot of times, like I have one patient, I actually talk with the primary care provider and make sure she's older. So she's doing her thing. I'm doing more lifestyle functional. And she's like, we'll meet in the middle and do our thing together. And a lot of times that's what I do with my supervising physician as well. Like we'll see patients together. And a lot of the patients, they want, especially, so I'll explain to you that in the medical community, there are horses. And so horses are regular people who have regular problems. Zebras are people who have extraordinary issues, who have problems, who doctors really don't go chasing after. Unicorns are what I have, which are make believe things, which are hard to even prove to exist in chronic illness and things like that. So, a lot of the patients, I need a primary care physician who will work well with you. I need somebody who will, work together with you that, we can get this problem together. They don't think I'm, who won't think I'm crazy or anything like that, and like trust your opinion, but also you trust theirs. And
Absolutely.
so, because I will tell you, like a lot of doctors still, they don't, you'll have different doctors. And so I'll have patients go to a primary or they'll go to a specialist and, oh, I've seen my functional person. So for instance, I have one patient in Atlanta, actually. She came down to see me. She thought she had long COVID, and she didn't have long COVID at all. It just so happened she had a pituitary tumor. And so the pituitary tumor had cut out her hormones, and she hadn't had hormones in 6 years. And so at that point, she was 44. And so she had stopped cycling at like 37. And so she was getting sick all the time. And she's like, what in the world is going on? And so I found the pituitary tumor. Well, her husband, they live up in Atlanta. I said, you need to see an endocrinologist or you need to see a neurosurgeon because it was teetering on the sides of being removed because it was about 1 centimeter. And so I said, you need to go see the endocrinologist. So they went to go see the endocrinologist, and the endocrinologist is like, at Emory, who picked this up? And they're like, oh, well, our functional medicine nurse practitioner. She rolled her eyes. And the husband's like, no, you don't get to roll your eyes. She
Mhm.
found it, you didn't. So there's a lot of doctors who are still, and extenders, so nurse practitioners and PAs who are still like, functional medicine is hogwash. Um, but it's looking at the patient as a whole. So you may have a patient, especially these chronic sick patients, who have a GI physician, a pulmonary physician, a cardiologist, endocrinologist, a radiologist. Like they've got all these numbers of physicians and they aren't talking.
Yes.
So I have a background where I used to work for a critical care doc who was also a pulmonologist, who was also in internal medicine, and who was also sleep medicine and critical care. And so with having a wide background of such of that nature, I'm able to put a lot of the puzzle pieces together with having that conventional background as well, and
Absolutely.
putting all of that together so that, so a lot of times, like I have elderly ladies that just need a voice because
Mhm.
they don't know what's going on because nobody will explain it to them. So
Mhm.
I take time and I sit there and explain it because some doctors, they just don't have the time,
No.
or maybe they just don't want to. I
Yeah.
honestly, I try to give everybody the benefit of the doubt that they actually want to take time with the patient to understand.
Mhm.
Um, but some, it's hard. And
It
so a
is.
lot of times it's, for me, it's a ministry. This is a ministry. It's trying to help people be heard. And a lot of times it's just trying to make people better.
Mhm.
And when they get better, and partly what has been my success, when they get better, they tell somebody else, they tell somebody else, they tell somebody else. If you don't know what's going on with you, Rebecca will figure it out.
Mhm.
And so I try to just listen, understand, do the right testing. And I don't, if I have to guess, I have to guess. But a lot of times, like you said, they just kind of guess, and it's
Mhm.
it's it's not necessarily what may be best or tailor fitted, if you want to say, or customized.
Absolutely, absolutely. And I love your background because I do feel like just like all physicians aren't created equal or have the same background, all functional medicine practitioners may not have the same background. So I think your extensive background in the medical field, like I said, working in internal medicine and critical care and sleep medicine, um, that you're able to really understand kind of both sides, and have a very like comprehensive education and understanding, which is how I found you, is just because I had so many patients that are like, yeah, my functional medicine practitioner, Rebecca Hart, Rebecca Hart. I kept hearing your name. I'm like, I've got to meet with you, Rebecca, because they're telling me all of these amazing success stories of how you've healed their gut, how you're working with them with their Lyme disease, and how they're really getting their life back, which is why I really wanted to be able to sit down and talk with you and highlight um, all of the amazing things that you and your team does. Because I know you said you have two practitioners that
Have
work with
to.
you.
Yep.
Okay,
Yeah,
that's
I couldn't do it. I couldn't do it all. I wish, but I couldn't do it all. So I'm happy to have Dallas and Lolita with me. And so they bring their own special niches to the table um, of what they do. And it's been an honor and a blessing to have both of them at the office as well. And the thing is, with a lot of these patients, it's also working on their, so it's working on the holistic, so it's working on the body, it's working on the mind, their spirit, because a lot of them are crushed. They are just crushed when they come in the office because they've been to Mayo. I've had one of them that's been to National Jewish in Colorado because she came from Colorado. They've been to multiple, and they have stacks of paper this thick when they come in of like, this is all what I've had done, this is everything. And it's hard for them. It's hard
Mhm.
for them. And I will tell you, some patients, it's hard for them to understand what functional is, because some of them are so tied to a diagnosis. In other words, it may be like fibromyalgia, or it may be, and it's like, but really, what's the root cause of your fibromyalgia? Yes, you hurt all over. I get that. But what is actually driving the fibromyalgia itself? So some patients, it's Epstein-Barr. So Epstein-Barr is a herpes virus, which causes mono. 40% of the population has it at age 9.
Wow.
So, but here we found recently, just in November at the conference, they were doing research, and they were doing basically studies on long COVID. And so they were basically showing that 41% of the population who had COVID had reactivated Epstein Barr. And
Wow.
then 60 something percent had reactivated human herpes virus 6. And so you wonder why these people are feeling sick. It's not necessarily, yes, COVID started it,
Yeah.
but what is now doing the damage now?
We've
It
heard
could be
so much
Epstein
about.
Barr.
Yeah, and that's something that I've heard so much about is long COVID, but long COVID definitely seems like a very much like an umbrella term that people aren't really able to fully define. So that is um very cool that you're getting all this new knowledge about truly what is this long COVID? What are these viruses that are being activated? This is the first time hearing about it, so that's really, really
Yeah,
fascinating.
and so I have one patient, her long COVID, she suffered 4 years. So after she had COVID, she really has Lyme. So her Lyme reactivated after the COVID because the COVID decreased the immune system. So here comes Lyme out to play. So
Wow.
because the immune system was being handled, or the immune system was handling the Lyme. So it's COVID completely stirred the pot. So all of these things are now, that's
Mhm.
why I said investigative work. I wasn't lying, because you have to investigate. Is it some viral issue that's causing for the patient? Is it Lyme? Is it a co-infection of Lyme? Or
Mhm.
is it, like I said, a viral load? Is it a parasite? Is it another bacteria of dysbiosis of the gut? Like it's on and on and on. Like I
Yeah,
could spend days.
I remember the last time we talked, I remember one of the things you mentioned was mold and how
Mold
uh,
is huge, especially here in
absolutely.
Savannah. So I treat a of mold, lot of mold. And so those I think are the most that get misunderstood by just providers, period, because it's not something you can see. And these people are so chronically ill, and it's their house that's actually making them ill, but it could have been the house before. So
Mhm.
they're in a clean house now. But if you don't get rid of those toxins, because 25% of the population have haplotype genetics where they cannot detox the mycotoxins. And so they can't detox them. If they can't detox them, they just stay sick and
Wow.
their immune system stays down. And I have women, usually I can tell the women because they'll have some sort of histamine issues where they'll have reflux, hives, anxiety, insomnia, they can't sleep well. They will have low testosterone. So that's huge for a woman. So I'm seeing 20-year-old women who should have testosterones in the 20s, maybe 30s, which is normal, but I'm seeing them less than 3. So
Wow.
why is that? Because all that testosterone is shunting over to estrogen. So mycotoxins increase aromatase. Aromatase is the enzyme that pushes all the testosterone to estrogen. So these girls, heavy cycles, heavy periods, PMS symptoms, all the excess estrogen. And guess what? When you have low progesterone compared to estrogen, you even have more histamine issues. And so you've got histamine on top of histamine. So you can have snotty nose, like I said, the hives, just all sorts of stuff. So these people are completely run down and completely ruined, and they just don't feel well.
Yeah.
Chronic fatigue, fibromyalgia, they're aching all over. And
So,
so, like, I had one, she was a teacher. So, teacher, I'm like, most schools notorious for mold. Why? During the summer, it's hot here. You think they're running the air condition when nobody's there? No. So most of the teachers come back to their rooms, they're highly moldy. So clean them up, not a problem, but that doesn't get everything. So long story, had a teacher, uh, a young black woman, and had a lot of fibroids, had a lot of issues with excess estrogen and stuff. And long story short, we ended up putting her on some binders. She's like, "Oh my gosh, Rebecca, I'm telling everybody about you. I'm not hurting anymore. I'm doing great." And have we completely, fully gotten where we need to get with her? No, but she's feeling so much better than what she did because now she's got the greatest, she's a great teacher, she's good with the kids, and she was just struggling. She's like, I can't make it. And she has a really good work ethic, but she's like, I can't make it from point A to point B. So I would have put my money on it that she had Epstein-Barr. She did not. She did not have reactivated Epstein-Barr at all. She had mold. And so
wow.
when we looked at all her markers for, it's called SEERS, which is chronic inflammatory response syndrome, they were all off the charts. So I started her on a binder, prescription binder, and since we have been, she is tons better, sleeping better, fibromyalgia is better, and she's doing great.
That is amazing. That is amazing. Well, I want to wrap up. We're almost out of time. I Your stories and when you talk about your your current patients and past patients, I always learn something every time we talk, and learn something new about chronic disease and illness. And I think that you are bringing such a light and a voice to people who maybe feel like they don't, who feel like they've
Yeah.
been dismissed. So I wanted to give you the last 3 minutes if you had any final words for our community about how to reach you, and about what they should do.
So, one, I tell people I learn 2 new things a day. because it is constant with the research and everything else trying to learn the greatest. That's another thing. Functional medicine is about 10 to 15 years ahead of conventional medicine.
Unbelievable.
So we are in Pooler, so right off of Canal Street. Our first appointment is 2 hours long, and it is 2 hours long for a reason because we literally spend all that time talking about the issues that the patient is having and how they are when they were born. Were they sick? Were they, did they have trauma? Because trauma, you carry that to adulthood, and that can make you chronically ill as well. So I have a lot of people that we have to work through trauma, um, and we teach that too. um, so we go through all of that. So there's myself, there's Lolita, and there's Dallas. So there's several of us to go around as far as at Faith, Hope, and Wellness. And basically, you call our office, and so you know, we can give you the office number. Do you want me to say the office number?
You can. I will make sure to link all of your information down
So
below.
basically, our office number, call the office number. Shannon is our office manager, and she'd be more than happy to talk to you about, everything that we do. Basically, we do anything that walks through the door. So, we'll do high blood pressure, we'll do chronic inflammation, we'll do high cholesterol, we'll say, I just want to live longer. Those are kind of the easy cases. And then we have other ones that are mystery cases and we have to figure them out. And some people, like we had some people just come in with straight up hair loss. And like the one that had hair loss, she actually had Lyme. The other one that had hair loss, he worked in a bank and he was exposed to mold. And we actually grew his hair back. How
Wow.
cool. Um, that was actually Lolita's patient, and he actually has his testimonial on our Facebook page.